So next chapter is about dysphagia. So dysphagia means difficulty in swallowing. And when will we say odynophagia? Odynophagia is used when swallowing causes pain. Okay. Next we are going to study about the etiology of dysphagia. Okay. And this dysphagia may be pre-esophageal. That is due to the disturbances in the oral or the pharyngeal phase of deglutition. Okay. So that is the pre-esophageal or maybe esophageal causes are there. Esophageal means there is disturbance in the esophageal phase. Okay. So the classification is clinically used as most of the pre-esophageal causes can be easily excluded by physical examination. Okay, the pre-esophageal causes we can exclude that by physical examination because we can see it while examination the pre-esophageal causes. But for esophageal causes we should require investigations. We require investigations for finding out the causes. Okay. Next. So, for pre-esophageal dysphagia, we can also use oropharyngeal dysphagia. Okay, what is happening in this means there is difficulty to push the bolus of food into the esophagus. Okay, and mainly the reasons may be neurological or muscular disorders. Okay, so neurological or muscular disorders are given. So, what are the causes of oropharyngeal dysphagia? There will be cerebrovascular accidents. Okay, CVA or maybe Parkinsonism, myasthenia gravis. Okay, Senger's diverticulum. Okay, this can be then amyotrophic lateral sclerosis. Okay, then laryngeal paralysis with the aspiration. Okay, then if there is any tumors of the oral tongue or piriform fossa, epiglottitis. Okay, tongue base. Okay, these are the main causes for the oropharyngeal dysphagia. And to find out any aspiration is there, you can do video fluoroscopy with the barium swallow. Okay, that is helpful in diagnosing and to see if any aspiration takes place. Okay. So first is the pre-esophageal causes. Oral phases and pharyngeal phase is there. And first the oral phase. In oral phase, mainly we know that the food first will be masticated, then lubricated with saliva and converted into a bolus by the movements of the tongue, and then that is pushed into the pharynx by the elevation of the tongue against the hard palate. Okay. So if there is any disturbance in the mastication like trismus, fracture of the mandible or temporomandibular joint disorders. Okay. Or there is tumors of the upper and lower jaw. These are the disturbance in the mastication. This will lead to disturbance in mastication. Next, if there is disturbance in the lubrication, that is xerostomia following a radiotherapy or Sjogren's disease. Okay, this will lead to disturbance in the lubrication and disturbance in the mobility of the tongue, that is paralysis of the tongue or any ulcers or tumors of the tongue or lingual abscess or total glossectomy. Okay, and defect of the palate like cleft palate or the oronasal fistula or the lesion of the buccal cavity and the floor of the mouth. Okay, that is the stomatitis, ulcerative lesions or the Ludwig's angina. Okay, though next is the pharyngeal phase. Pharyngeal phase means for a normal swallow, the food should enter the pharynx, then it should be directed towards the esophageal opening. So, for that, all the unwanted communications into the nasopharynx, that is the larynx, oral cavity should be closed. Okay, so if there is any disturbance in this phase, this will lead to defect in that one. Okay, so first obstructive lesions. There will be obstructive lesions of the pharynx. So pharynx adenoid ആണെങ്കിൽ there will be adenoid hypertrophy വരുന്നത്. Okay, hypertrophic ആയിട്ടുള്ള അല്ലെങ്കിൽ ടോൺസിൽ നമ്മൾ പറയുകയാണെങ്കിൽ tumors of the tonsil. Okay, tumors of the tonsil അല്ലെങ്കിൽ tumors of the soft palate, pharynx അല്ലെങ്കിൽ base of the tongue tumor വരുന്നത് അല്ലെങ്കിൽ supraglottic larynx or even obstructive hypertrophic tonsils. Okay, so obstructive lesions first tumors പറയുന്നത് ഏതൊക്കെ tumors വേണം? Tumors of the tonsil, soft palate, base of the tongue, suprapharynx, supraglottic larynx or even obstructive ആയിട്ടുള്ള hypertrophic tonsils ആവാം. Okay, these are the obstructive lesions of the pharynx. Next, inflammatory conditions. Okay, inflammatory conditionsൽ mainly നമ്മൾ ഏതൊക്കെയാണ് വരുന്നത്? അക്യൂട്ടായിട്ട് വരുന്ന ടോൺസിലൈറ്റിസ് അല്ലെങ്കിൽ പെരിടോൺസിലർ ആബ്സസ്, റെട്രോഫാരഞ്ചൽ ആബ്സസസ്, അതുപോലെ തന്നെ പാരാഫാരഞ്ചൽ ആബ്സസസ് അല്ലെങ്കിൽ അക്യൂട്ടായിട്ടുള്ള എപ്പിഗ്ലോട്ടിറ്റിസ് അല്ലെങ്കിൽ എഡിമ ലാരൻസ്. ഓക്കെ, ദീസ് ആർ ദ ഇൻഫ്ലമേറ്ററി കണ്ടീഷൻസ് ആൻഡ് സ്പാസ്മോഡിക് കണ്ടീഷൻസ് വരാം ഇൻ കേസ് ഓഫ് ടെറ്റനസ് ആൻഡ് റേബീസ് ആൻഡ് പാലറ്റിക് കണ്ടീഷൻസ് ഉണ്ടാവും. അതായത് എന്തെങ്കിലും ഇൻ കേസ് ഓഫ് ബൾബാർ പാൽസി. ഓക്കെ, അല്ലെങ്കിൽ പാരലിസിസ് ഓഫ് ദ സോഫ്റ്റ് പാലറ്റ് ഡ്യൂ ടു ദി ഡിഫ്തീരിയ കാരണം സോഫ്റ്റ് പാലറ്റ് പാരലിസ് വരുന്നത് അല്ലെങ്കിൽ CVA. ഓക്കെ, ഇതെല്ലാം മെയിൻലി ലീഡ് ടു റീഗർഗിറ്റേഷൻസ് ഇൻ ദ nose. ഇതൊന്നും അല്ലെങ്കിൽ there will be paralysis of the larynx അല്ലെങ്കിൽ lesions of the vagus and bilateral superior laryngeals causing aspiration of the food into the larynx. Okay, so these are the pharyngeal phases. Okay, so next is the esophageal causes. Esophageal causes means here the lesion may be in the lumen or in the wall or outside the wall of the esophagus. Lumen means there is an obstruction to the lumen. Okay, that occur in case of atresia or some benign or malignant tumors or foreign body strictures. So this leads to obstruction to the lumen or in the wall there may be like esophagitis, like acute or chronic esophagitis, or some motility disorders like hypermotility disorders and hypermotility disorders. Hypermotility disorders are the achalasia, okay, remember one, achalasia or scleroderma, okay, and hypermotility disorders may be there. Hypermotility, that is diffuse esophageal spasm or cricopharyngeal spasm. This is outside the wall. There will be some lesions that will obstruct the esophagus by pressing on the esophagus from outside, okay. For that, the examples are the hypopharyngeal diverticulum, and then hypopharyngeal diverticulum, hiatus hernia, okay. So outside the lumen, others are the cervical osteophytes, or there will be mediastinal lesions like tumors of the mediastinum, lymph node enlargement, aortic aneurysm, cardiac enlargement, okay. Then thyroid lesions like thyroid enlargement or thyroid tumor, Hashimoto thyroiditis, or vascular rings, okay. So these are the lesions which are seen outside the esophagus, which leads to obstruction of the lumen of the esophagus, okay. So in this case, what all investigations you should do? First, you should take the history. Then you should clinical examination, blood examination, radiography. Then you should do the manometric and PA studies. Then upper GI endoscopy and other investigation. So this is the investigation modality. So first you are going to study about the history.